good. My name is Sarah. I'm going to be your nurse today. I'm washing my hands and putting on gloves. I'm going to be here to do an assessment on you, okay? Make sure that you are doing okay today.
Okay.
Can you do me a favor and tell me your name and date of birth?
Zoe Lennox, 5/18/98.
All right. And what's baby's name?
Charlotte.
All right. I'm going to look at Charlotte's band. Can you tell me the numbers on your band, Zoe?
1, 2, 3, 4, 5.
Awesome. And are you breastfeeding or bottle feeding, baby Charlotte?
I've been breastfeeding.
All right. How's that going?
It's pretty good. I had the lactation consultant come in a little bit. She was having some trouble latching. I don't know why.
It's okay. Baby's got to get adjusted just like moms do. Okay? And it does take some time.
Okay.
Can I take baby Charlotte and put her in her crib?
Of course.
All right. Hi, honey. Go right over here. And she is nice and safe and sound. So, you said you were breastfeeding.
Mm-hmm.
All right. Are you experiencing any cracked nipples? Any dryness?
I did have a little bit of dryness, and they were a little bit cracky, but I don't know what I can use to help with that.
So they left some lanolin cream right here,
Okay.
and you can definitely rub that on your nipples. It is safe to use when baby feeds, okay?
Awesome. Okay.
All right. I'm going to palpate your breast. All right, so I'm going to bring this out, and I'm going to ask you to palpate along with me on the other breast.
Okay.
We're feeling for any nodules, hardness, nodes, or anything like that. Do you feel anything?
I felt a little bit of a hard spot, and I just wasn't sure what that was.
All right, so those are usually clogged ducts. And what you're going to want to do is kind of massage down towards the nipple and express it out with your milk, okay?
Okay.
Make sure that you're wearing a loose-fitting bra, all right? The only time I get concerned about hardness in your breast is if there's any redness, warmth, and accompanied with fever of 100.4 or greater. That's usually a sign of mastitis. And with mastitis, it's just an infection in your breast from those clogged ducts. And call your doctor. They'll be able to prescribe you an antibiotic.
Okay.
Okay. You might feel some fullness and some pain.
Yeah.
That's your milk supply coming in. It's called engorgement. Totally normal. Okay. And you can help that by alternating breasts as you breastfeed.
Okay.
Okay. What we're going to do next is we're going to feel your uterus.
Okay.
Okay. So we're going to go right here at the top. If you'll bring your hand up here so you can feel it as well. Feel how firm that is?
Yes.
That's what we want to feel.
Okay.
Okay. So as your uterus shrinks back down to its normal size, it's going to go down about 1 finger breadth each day.
Okay.
Okay. You want that. If it starts to feel soft or boggy, you need to call us and let us know.
Okay.
Okay. It is normal to have a little bit of clotting, no more than nickel size. And I'll tell you a little bit more about that when we get down to check your peri pad.
Okay.
Okay. But before that, how are you urinating?
I've been going about every 2 hours.
Okay. You want to make sure that you keep going every 2 hours. You definitely want to increase your fluids. Make sure that you're peeing at least 150 milliliters each time. But we want you to be safe when you do it. So if you need any help getting to the bathroom, make sure to use that call light. We'll be more than happy to help you. When you get into the bathroom, we want to make sure that you're not locking the door so we can get to you if something happens.
Okay.
If it burns, has it been burning?
A little bit.
Okay, so if it burns, there's a lot of stuff in your bathroom that we can use to help with that. So we have the peri bottle. Have you used that yet?
I haven't used it yet.
It's amazing. It'll be your best friend.
Okay.
So you can fill it with warm or cold water. Most women prefer warm.
Okay.
You're going to make sure that you're not making any contact, and you're going to spray front to back, okay?
Okay.
You can use that while you're urinating or while you're defecating, okay?
Okay.
We also have Tux pads, which are witch hazel pads, and you're going to use those the same way. Kind of dab front to back.
Mm-hmm.
You can also put them on the ice pack that we left in there. You can line them up on the ice pack and apply it to your peri area,
Okay.
okay? There's also Dermaplast spray, which is a numbing spray. It's phenomenal.
Okay.
You can spray those on the Tux pads and put them on your peri area, or you can spray it directly on. Just make sure you're not making contact with the bottle. Okay.
What happens if it does touch at all?
You don't want it to. It can cause infection.
Okay.
You don't want to stick anything inside of your vagina or on your vagina other than the ice pack, the Tux pads, and your peri pad. Okay. So no sex, no tampons, no douching, anything like that until you've had your 6-week appointment with your doctor and have gotten the clearance from that.
Okay.
Okay.
All right.
How's your bowel movements going?
I haven't gone since I had births, like right before that.
Totally normal. There's a couple things we can do about that. So your doctor has a order for Colace. That's a stool softener. That'll help kind of move everything. The biggest thing, drinking plenty of fluids, lots of movement. So I recommend that every time that you breastfeed your baby, you get up and kind of do a lap around the hallway. Okay? Lots of fiber. All right? So make sure you're eating those fruits, those veggies, and all the yummy food that we're sending to your room. Okay? If you need any help and you feel like you need to defecate, we can definitely come and help you. Use that peri bottle with that warm water to kind of help relax everything, and then dermoplast spray as well.
Okay. What about, like, I'm kind of afraid to go just because they had to do that cut when I had my baby.
So, I'm going to check your episiotomy in just a moment.
Okay.
Make sure that everything's going good. But once again, you can use that dermoplast spray, those tucks, and an ice pack to kind of help relax everything. We can also give you a little bit of an NSAID, which is like Advil. Okay. And we want to make sure that you're increasing those fluids and you're having that bowel movement, because they did give you a lot of pain medication and it does cause constipation. Okay.
I gotcha.
All right. So the next I'm going to check your lochia. All right. So I'm just going to kind of ask you to spread your legs a little bit. I'm going to look at this pad. All right. So your blood is bright red, totally normal for day 1 to 3. All right. And then from day 4 to 10, it's going to come like a brick color. Okay. From day 1 to 3, you may have some blood clotting. Shouldn't be larger than a nickel. And they're going to be kind of spread out here and there. Totally normal. By day 4 to 10, you should not see those blood clots. And that's when that color is going to change. All right. And then from day 11 to about 2 weeks, you're going to have a little bit of like a mustardy color discharge. And it's going to go towards clear. Okay. That's the progression we want to see. If at any point your discharge starts to smell, a pungent smell, you want to call us. That can be a sign of infection. Or if you're going through more than one peri pad in an hour, that also can be a sign of a complication. And you want to call us as well if that happens, okay?
Okay, I will.
So now I'm going to check your episiotomy.
Okay.
All right, so I'm going to have you roll over to your side. All right, that looks great. So with your episiotomy, what I was looking for is Rita, okay? So that's redness, ecchymosis, edema, drainage, and approximation. Everything looks great. I don't see any bruising. I didn't see any edema. There's no drainage coming from it. And your incisions are coming together wonderfully. So that's your approximation right there.
Okay.
Okay. So then I am going to check your legs. All right. And I'm just looking for edema right now. You do have a little bit right here at the end, which is totally normal. We pumped you full of fluids to get that baby out, okay?
Okay.
I'm going to ask you to point your toes to your nose. Wonderful. Did you have any pain with that?
No.
All right. So what I was checking for there is any signs of blood clots as well. You want to make sure that you're moving around as much as you can, safely, but that you're moving around, and that'll help reduce your risk for blood clots as well. Okay?
Okay.
How have you been feeling since having the baby?
I've been feeling okay. I'm a little anxious because it's my first baby.
Yeah, understood. And that's completely normal. So, you might experience some crying, a little bit of sadness. For the first 2 weeks, that's just called baby blues. Okay? Completely normal. Your hormones are all over the place. They're trying to come back down to normal. You just gave birth. You may not be sleeping well, getting adjusted. Completely fine. If it goes past that 2 weeks, what we're concerned about there is something called postpartum depression. If it does go past 2 weeks, we do ask that you please call your doctor. We do not want you to suffer alone, okay?
Okay.
There's a lot of things that your physician can do to help you with that, all right? The biggest concern we have is something called postpartum psychosis, okay? If you ever feel like you're going to hurt yourself or your baby, what we want you to do is take baby and put them in their crib. Okay, and we want you to close the door and go into a separate room and call for help. All right, there's no judgment, and your safety and baby safety is our biggest concern there. All right.
Okay.
Do you feel like you're bonding okay with baby?
I feel like we're bonding pretty well. I don't know about my husband. I'm not really sure, but I'm gonna keep my eye out for it.
Okay. And if you need any help, once again, just call and let us know. And if you have any issues with breastfeeding, or any questions that come up, you can always call our lactation staff and they can answer any questions that you have.
Okay.
All right. So, with baby, We want to make sure that we're doing the ABCs of sleep, okay? So you want them to sleep alone, on their back, and in a crib, okay? Being a new mom, you get super tired, and we totally understand, but we do want to make sure that you're not sleeping with the baby in the bed with you, okay? That can be a big hazard for both of y'all, all right?
Okay.
Would you like baby Charlotte back?
Yeah, I would.
All right. Here we go. All right. Do you have any questions for me?
I don't think so.
Okay. All right. Well, make sure to use that call light if you need to use the bathroom, okay?
Okay. All right.
All right.
Thank you.
I'll see you later, Miss Zoe.
All right.